Hi there, my name is Dr. Chris Bunn. If you're watching this video right now, it means that you're suffering with neuropathy, but that you're also taking an active role in looking for alternative solutions to your pain and loss of function. I want to congratulate you for that. The reason for this is because 98% of people that are suffering with neuropathy right now are just okay to accept the current medical model. You see, we're treating neuropathy in our country only one way, and that's with drugs that cover up the symptoms until the condition gets so progressively bad that we have to amputate limbs. To me, that's insane. What if there was a better way that we could treat neuropathy based on physiological function and what was really going on inside your body? Bear with me for a moment here. If you can imagine this plant, this is a little green flower. What does that flower need to grow? Well, it needs sunlight, it needs water, it needs oxygen, it needs all of those things. Well, your nerves are much like this plant right here. If they're not getting the proper oxygen supply, if they're not getting proper circulation because your blood sugar levels are too high, then those nerves don't grow like they're supposed to. They get choked off and they die, right? That makes total sense. So we need rain down on this poor little plant, and we need oxygen and we need sunlight. Well, your nerves are exactly the same. You see, the problem with drug therapies to treat neuropathy is they don't provide any additional oxygenation, and they don't really heal the nerve. They don't really provide any solution to the problem. All they do is they cover up the symptoms. So there's a fantastic and amazing new way of treating this that focuses on increasing circulation. There's a product called an anodyne and a rebuilder, and we've used extensively in my office. Now, the one problem that's been with those devices is that they're pretty expensive, right? You might be sitting there saying to yourself, a piece of home medical supply sounds pretty expensive to me. So here's the story, and here's how I've solved that problem for you. See, I used to run a big, busy office with lots of staff and lots of overhead, and when somebody would come in to get treated, we would have to give them these treatments, and we'd have to have them in the office, but we would charge them for an office visit every time. A couple of years back, I decided there had to be a better way. I still remember the day. This little old lady came in, and I could tell that she was hurting. She needed the care, but she flat out couldn't afford it. And the reason that she couldn't afford it is because my office overhead, I had to charge so much in order to deliver these goods to her that I was part of the equation. So what I've decided to do is take myself out of the equation. I'm coming to you today from my home office. You can see that it's really, really fancy. But what I've decided is this is a subject that hits really close to home with me. I've got a son who's a type 1 diabetic who's been diagnosed as a type 1 diabetic when he was 6 years old. So we've been living with this for the past 12 years. So diabetes and neuropathy is a subject that's very, very near and dear to my heart. And I feel like I've got a mission to try to help as many of you that are suffering with neuropathy as I possibly can. So I'm going to make it really, really simple for you. We've got a special offer. I will come to your house. You don't even have to drive to my office. See, that's a big thing that was a problem with my office is people have to drive 3 or 4 times a week to come into my office to receive treatment. We're bypassing all of that. We're giving you the goods, we're giving you the services, we're giving you the tools that you need to heal yourself in the comfort of your own home. And I'm going to come to you and I'm going to show you how to do that because I don't have an office anymore. I don't have any overhead. So I can pass the savings along to you. I can take as long as I need to sit down with you and explain to you how these tools are going to help you to heal from your neuropathy. So here's what you're going to do. I'm going to come to your house. I'm going to perform an 8-point neurologic evaluation to make sure that your nerves aren't too far gone, because your nerves can be too far gone with diabetes and with neuropathy. They can be to the point where they're irreparable. And if that's the case, then I'm going to tell you that. Second thing I'm going to do is I'm going to bring these cool tools with me. We're going to hook them up. We're going to throw them on you. We're going to show you exactly how they work. And we're going to do all of this for only $20. Provided that you're a good candidate for our care, provided that you can understand how to hook these up. This is what it's all about. This is the future of healthcare. I don't believe that the future of healthcare is to drive to an office, to have a big staff, a big overhead, and basically it needs to be more patient-centered. And we need to go to smaller doctor's offices, and that's what I'm really trying to do here. So again, I still do have some overhead. So I'm going to ask $20 to cover my time and my gas and my travel to get to your house. Listen, I'm going to sit down with you. I'm going to go over this. I'm going to explain this in detail to you. And I'm going to get you the care and the solutions that you need to your neuropathy. And if I can't, I'm going to get you somebody else who can. $20 is a good deal. And what I need you to do, fill out the form below. Click on the button below. And also, before you do that, I want you to go ahead and I want you to read through some of these testimonials, because a lot of times people think, yeah, it might have worked for so-and-so, it might have worked. How is this going to work for me? Listen, there's so many people out there that are saying the exact thing, that used to said the exact same thing that you're saying right now. I don't think that this will work for me. Well, some of their stories are below, so I encourage you to go ahead and take a look at those. Hey, click on that button, and I can't wait to meet you, help you out with your neuropathy. Take care.